We have, when doing a tummy tuck, is there a technique you use to help reduce the hanging skin in the upper back? And also, how do you determine the cut with the incision? V cut or depends on person's body?
Hanging skin in the upper back. So when you're talking about a tummy tuck, the upper back is, like the bra roll area or actually in the back. That is not really part of a standard tummy tuck.
Mm-hmm.
So sometimes you can combine them, but depending on where the scars are going to be, in most cases, those get staged out and the tummy tuck is done first and then the back skin is addressed later. So that's the short answer to that one. Because if the skin is kind of on the side, then when you do the tummy tuck pulling in and down, sometimes it will address that. And
Mm-hmm.
then maybe you don't want the scar there. Because when you put a scar either in the flank or on the back, it's pretty noticeable. People don't always like those scars. But for patients that have lost massive amounts of weight, like a lot of weight,
Mm-hmm.
then trade-off is clearly in the favor of going for the scar because if there's so much loose skin, it's better to do that. Most people are much happier with that trade-off. In terms of where the scar goes, for the tummy tuck, I like to put it in the natural skin crease of where the body kind of wants the scar to be. Sometimes people don't really have an obvious crease, and then I just go by the measurements and the marking to try to get it, where it needs to go. And again, putting it where the body wants it to be is one way you have a better chance of getting a nice thin scar. And the other thing is just taking care of the scars afterward. And, there's a couple of different things that can be done. And I usually like people to pay close attention to that for about the first 3 months after surgery so that the scars come out thin. If you're taking a lot of skin out in the non-massive weight loss population, if there's tightness on that closure, then it can lead to a little bit wider scars. So you kind of have to judge how much is going on. But people that have a lot of stretched out skin, like lots of stretch marks, usually they don't form very thick scars because that dermal layer has been thinned out by, when they previously had a lot of weight on board. And when that layer is thin, it just doesn't tend to make a very thick scar. That's kind of what we notice from doing this from clinical experience.